My name's Dr. Fred Calavassi, and I'm the Clinical Director for Abano Healthcare. We service over 260 dental practices in Australia and New Zealand, supporting over approximately 700 dental clinicians, oral health practitioners throughout Australia and New Zealand. Historically, I'm a dentist by profession, and I'm a clinical educator in the past. And now my role is as the Clinical Director for Abano Healthcare. I think it's really important that we understand the effect of dental disease globally as well. So the World Health Organization has identified that oral health diseases pose a major health risk for the world population, with over 3.5 billion, that's 3.5 billion people affected by dental disease around the world. Bring this closer to home. According to various different articles that are published in Australia, the published data shows that dental infection is actually a significant public health risk in Australia. Now, that's substantial. Dental disease is a significant public health risk in Australia. The most common reasons for preventable hospital admissions in Australia were dental decay, which was really what we heard from a moment ago from the WHO, with 3.5 billion people worldwide affected by dental decay. It's also followed by impacted or embedded teeth, which is causing hospitalizations. But other causes of preventable hospitalizations include, which we've just mentioned, dental decay, gum disease, other infections of the teeth and gums, and also trauma. The average rate of potentially preventable hospitalizations per 1,000 of population in Australia for all ages ranges from approximately 2.6 to 3.2, and it's remained fairly stable from 2010 to 2021. Though what is worrying, though, is that the effect of potential preventable hospitalizations in children aged 5 to 9 is the highest, with a rate of 10.9 per 1,000 head of population. Now, that's 3 times the national average for our children. So our children are being hospitalised due to dental conditions at a much greater rate than our adult population. Nationally, dental conditions were the third leading cause of potentially preventable hospitalisations in Australia, though dental conditions were the leading cause of potentially preventable hospitalisations for children aged between 5 and 14, according to a national study. And it was also the second leading cause of potentially preventable hospitalisation in children aged 0 to 4, our real youngsters. The Child Dental Benefits Schedule was established in 2014 as a national and means-tested program. It was for those that receive a relevant Australian government payment, such as Family Tax Benefit A, at any point in the calendar year, and it provides eligible children aged between 0 and 17 years of age. It used to be between 2 and 17 years of age, with a capped benefit for basic dental services. And it provides $1,052 currently of dental benefits over a 2-year period for children in that age group. The dental services can also be provided by dentists, dental hygienists, dental therapists, dental prosthetists, and oral health therapists. But before speaking of the scheme, let's discuss some facts about oral health care in children, realistically. Already, we've spoken about the high rates of potentially preventable hospitalisations in children that are aged between 5 and 14 years of age. But it's a fact that 65% of 6-year-olds had experienced dental decay in their primary or baby teeth in Australia. That's substantial. And 48%, almost half of our children aged 12 years old, had experienced decay in their permanent dentition, their permanent teeth. So we have a severe issue that's going on with our children with regards to dental decay and the effect that it has on their overall health and well-being. And also what's concerning is nationally, 11% of children aged between 5 to 14 have never visited a dentist. That's 1 in 10. Now, that's a substantial statistic. But the factors that are contributing to dental health decline are things like consumption of sweetened beverages, sugary drinks, soft drinks, cordials, energy drinks, fruit juices, etc. All of these things increase the rate of decay in our children's teeth, and we're seeing a much greater uptake of these products as we become more consumer driven. Consumption of other snacks that contain sugar as well, high sugar content, sticky foods, etc., that cause high rates of decay within the children. Lack of good oral hygiene and regular dental checks. We just mentioned that it's only 1 in 10 children have never seen a dentist. Also, the lack of access and exposure to fluoridated water. Fluoridated water has been an absolute godsend for the reduction of dental decay in our communities. However, it does only strengthen the surface of the teeth, so the underlying structure of the tooth can really cause substantial problems with regards to decay if it goes unchecked and untreated. And the last thing is the long public waiting periods for dental care in the public service. So the importance of the link between the public sector and the private sector is absolutely critical, and this is where the Child Dental Benefit Schedule has come to the fore. Despite an expansion of the eligibility criteria for the Child Dental Benefit Schedule, there still hasn't been a great deal of uptake of the Child Dental Benefit Scheme in Australia, with only 30% of eligible patients and eligible children undertaking care that's being provided through the Child Dental Benefit Scheme. So again, we have a long way to go with regards to the impact that the Child Dental Benefit Scheme has on the Australian dental population. The big advantage of the Child Dental Benefit Scheme is that it provides access to those populations within Australia that really require the access, those with lower levels of oral hygiene, or have experienced parents that have lower levels of oral hygiene also. The barriers for uptake of the Children's Dental Benefits Scheme have been really due to limited general public knowledge of the CDBS. And an opportunity obviously exists to work with professional bodies such as the Australian Dental Industry Association or the Australian Dental Association, and also private sector practices, so that we can actually expand the program to those eligible children to try and minimise the incredible impacts that we have from dental decay. Most of these potentially preventable hospitalisations could have been prevented because dental caries and gum disease are preventable diseases. All of these diseases which are causing these potential hospitalisations in children are preventable. And another advantage is that, you know, the private dental sector, of the 15,500 dentists that have provided services under the Child Dental Benefit Scheme, approximately 80% of private dental practitioners have provided services under the Children's Dental Benefit Scheme to children. So that shows a real support by the profession for the Child Dental Benefit Scheme to support the government's plan to minimise highly potential preventable hospitalisations. The Children's Dental Benefit Schedule, despite its uptake, has a substantial potential to reduce dental disease and preventable hospitalisations for our children in Australia. Unfortunately, there's limited public knowledge of the CDBS. So an opportunity, as I mentioned before, exists to work with industry associations such as the Australian Dental Industry Association or the Australian Dental Association to increase general public knowledge. Currently, there's really no public driver to support dental checkups in the market. So the opportunity to encourage children, encourage parents of those children to bring their children in is extremely important. There could be a possibility of having some form of public driver to minimise the risk of dental decay in the community by increasing the uptake of the Children's Dental Benefit Schedule. Communication via letters, through MyGov, and direct communication with patients is something that needs to be a little bit more voucher-like, something that will encourage parents of children to bring their children into the dentist to undertake examinations through the Children's Dental Benefit Schedule. So it's extremely important that we work collaboratively as a profession, as industry associations, and with local government, state and federal government as well, to try and increase the Child Dental Benefit Schedule and the impact that it would have and the improvement that it would have on the reduction of dental decay for our children in Australia.